Hello. Oopsie. I don't know if it says it is on live. Yay. Okay. I've been struggling. Sorry. This is my first time doing this in English. And I did my first one yesterday, but that was also a struggle. So I'm sorry about this. My apology. So I will be starting in 30 seconds or so, because I wanted to wait for some people if they're going to the previous link that was originally given out. And let's see if anyone's going to join. Let's see. Because if no one can join, but still okay, I'm just gathering the information. I'm just giving out the information for our clients so that they can just watch the recordings anytime. So let's see if we can dive into the information. So I want to make sure to not declare, but I wanted to announce that this information session has a lot of information, and that should not be delivered to other people after interpreting for yourself, because these informations are based on at least 50 pages of the new informations that was given given out by the government. And I try to be very neutral, even though it will be a little bit difficult because I'm the service providers. I will be affected by this too. However, I really wanted to make sure that I provide the informations that you really, really need in English, and to not to misunderstand, like not to lead any misunderstanding to any of the information that was given out. So please do pay attention to all of it, because everything is already summarized. And I think it will be really important that we know what is going to be the different structures of the funding and what is going to be the criteria, even though there will be a lot of gray areas that we'll have to still wait for any updates. So, these slides are also, I made the summarized ones, and I also tried to capture some of information from the original source into this material. And I won't be sharing this material, but if you need any information from this material, please, you're welcome to come back to this material anytime through the information session, because I won't be deleting the recordings until long time later. So let's go. So this funding system will be all new and different from 2027, April. The vision, so the reason why they are doing this is because they are trying to distribute the fundings for kids with the different needs. And that is actually going, like, it is very aligning with other provinces on the east side too, because they are like already doing the same thing. They are only accepting the kids with the highest needs for the maximum amount, and then they are lowering the amounts based on their needs. So I think BC is actually trying to do the same. And they are also trying to include the individuals with the special needs that is not only autism, but also other difficult or complex conditions, because that has been an issue for a few years by now. And they are trying to make some steps a little bit simpler. So we'll go into that. And they are expanding the community-based services into a few years. I think they're targeting for 3 years to expand all the services. And they are actually giving some choices to the clients, at least for the benefits, about how they are going to get paid. And by the way, if you have any question, if you are here, then leave in the chat. And I know there is some delays in the video streaming, but I will go back to the question if this is something that I can give, like answer based on the information that's already released. So the big structure of the new funding system are 3 things. First, it will be the direct funding. It's called the benefit. And this is something that they will say this is only about the needs. Oh, this is too late. So if you have the kids with the higher needs, then they're going to give you the benefit. And this is not based on the income. So no matter how much income you're making as a household, that won't be matter. And for the financial aid, that will be more of the supplements. So this is the income tested. So there is a threshold and there will be different amounts of the supplements based on how much you're making as a household. Also, the eligibility will be determined by if you have the DTC or not. And lastly, this is the community service that they're saying they are trying to expand in the future, and they have different timelines for which service area they are going to be expanding. So we will go into that later. Okay, so let's dive into it. So first, we'll go over the benefit. The first one it will be called CYSN disability benefit, and this is non-income tested direct funding system for any minors with the needs. And they are going to call it highest enduring functional support needs. I think this functional support is very important in here because when we are going into the eligibility, we'll talk a little more about it, but this is actually going to talk about more of the adaptive skills. And once you are eligible, then the base level starts from 6,500 per year, and that will keep going up to 17,000 based on the kids' needs. So how much intensive and substantial support they need throughout the daily lives. So they are saying they're going to. I made a mistake in Korean info session, but actually the new investment like this is expecting to serve 12 to 15,000 more children across BC. So, well, like I think this is going to be the kids who doesn't have the diagnosis of autism yet, so they didn't have the funding, but then the people who've been interacting with them have been struggling because they are high needs. So if you are eligible, then there are two different, oh no, if you are eligible, you will probably go through either pathway A or pathway B. So this is how they are going to determine if your child is eligible for this or not. So first is going to be direct admit, and this is highly based on the diagnosis. So if your child's any kind of doctor's report or maybe diagnostic evaluation report or psych ed report, anything, if these are already there, then you're already highly likely to get the benefits, at least starting from 6,500. But if you don't have something that's including these, we'll go into the list later again. But if you don't have them, but everyone around the kid is struggling because they need a lot of support, then they are saying they have some other ways to determine how much support they need, even though the diagnosis sound they don't need that much support. And this is more of the gray area that I mentioned in the earlier because they're saying here, I want to highlight this. So assessment process being defined with the clinical expert through 2026. So this is not determined yet. And I think this will be something that we'll have to wait badly because even in the FAQ sessions, and I think we'll have another slide there too, but they are still in the discussion. So we'll go into that later. So for the first pathway, which has the list of the diagnoses, are these. So if you have any of these in the list from your diagnostic evaluation report, then your child will be highly likely, not highly likely, automatically qualify for this benefit. So that will include moderate to profound intellectual disability. So intellectual disability, and if we're looking at moderate to profound, I will be uploading another video maybe in the close future, but intellectual disability has different levels, and recent changes in the DSM-5 shows that moderate to profound is not only the IQs anymore from DSM-5. So it will be more about adaptive skills. So they're looking at how they are adapted to the daily lives, and sometimes it correlates with the IQ, but sometimes it doesn't. So I think they're looking at the adaptive skills as well with the different questionnaires or observations. So usually, if I can give you a rough numbers for the moderate is somebody has to be at least 40 in order to be considered 40 in order to be considered profound, and over 40 that will be moderate. But I think I need to go back to the numbers, but moderate range will be over 40, and I think under, let me just check. I have the recent information here. So in the traditional diagnostic evaluation, they were saying 35 to 50 is the moderate, but nowadays usually people say, oh, okay. People usually say it's about the adaptive skills. So moderate can be somewhere between 35 to 55, and mild can be 50 to 70 or somewhere like this. So that is more of the traditional range. And if you're looking at the adaptive skills, the doctors will determine a little bit differently. So we need to read through the reports a little bit more, how they gave the diagnosis. And I think because we're talking about more of the kids with autism, I think this is something that we want to focus on. So if your child has autism and combined with any level of intellectual disability, then you will be automatically qualified. But borderline intellectual conditions is actually only translated in Korean. That is the disability or disorder, but in English, it's not included in the intellectual disability. So I'm not too sure how they're going to be doing it, but if your child had a borderline intellectual difficulties or conditions, then I think it may not be included here. So we need to look at either mild or moderate intellectual disability or profound to be eligible. And this is something that will be very difficult to say because high-dist support needs are not usually the doctor's notes saying, but usually they may say substantial support or lifelong support or intensive support. So I think this is something that we need to wait until how the experts are deciding the words, like what are the wordings that they are going to be accepting in order to consider that as a high-dist support needs. So if you're interested, you can go back to 36 pages of originally given out the guidelines because they have the list here, but this is including all of those that was in the previous one. So it's a little bit longer, and autism and intellectual disability together should be always considered. And level 3 autism, meaning level 3 autism is actually, even though you don't have the intellectual disability, but still you require a lot of support. So that's more of the high-dist support we are looking at. And if your child already has at-home funding, then you will be automatically qualified. And that means the school-aged children's therapy fundings from at-home program will be transferred to the benefit. And I think the amounts at total will be decreased as per therapy. So that's why I think they are making somebody who's already in the at-home program, then they will be automatically eligible for this. And if you have the autism, but you have these types of psychological problems that's already diagnosed by the doctor, then you will be also automatically eligible. Okay, and so here, this is what I mentioned as a gray area that we're going to be going over later. So how they will determine that if someone is with a high, moderate, low, or profound needs. And they are saying that between March 2026 to like end March 2027, they're going to be working with the experts and service providers and every partners to develop the criterias and the tools. So what are we going to use to evaluate or assess, and what are the criteria that we are going to be saying if this child has a mild, low, high, profound difficulties that needs intensive support. So I think if this goes well, I think it's a very good change, because what they're saying is very true, that they're trying to make the assessment of the needs to be determined if this child has to get the highest fund. It should be fair. They're trying to make the system fair, because they know that with the traditional diagnostic categories are sometimes not capturing those kids who really needs the support, even though their diagnosis doesn't show. So I think I'm really wishing for the best for this process. So yeah, so we're just waiting. And I think when they said this, but I think they will have to determine some ways and announce it before March 2027, because that's already end of autism funding. And I think it will be really last minute to decide for other kids in the autism funding. So I'm thinking they're giving the timelines that maybe they can do it early, but they just want to give out enough timelines so that all the people can wait. So here, they're also working on what's the assessment and then what trainings will they have is also the discussion. So we'll just have to wait. So this is what I really feel frustrated that I cannot give out the right answer for this. So we'll have to just wait and see. Needs-based are, that's what this is related about. So this one, we will have to wait for who's gonna be using what to determine the needs of one learner. Okay, so if you are eligible for the benefit, these are the expenses that you can use and where you cannot use for. So first, when you are eligible already, you will be able to use it for a lot of different areas, that as long as it is related with the intervention slash therapies. So here, when they say respite care here, actually, if you are already receiving any types of respite care, then it doesn't stop you to receive that service. It's not going to be additional cost. It's just saying that even with this new benefit, you will be able to use your own benefit to increase the additional respite care by hiring somebody to take your child for the respite care. So that's what it means. So maybe you can hire maybe SLPA or OTA or BI to provide the respite care if you feel they are the safe, and they can also provide you the respite care service, because they are going to be saying okay that you can spend the money for the respite care as long as they are registered as the respite care service provider. And other services are also written in here, and it seems like they are going to be making sure that all the benefits are used for the intervention related services. And ineligible expenses, so where you cannot use the benefit, will be unresearched intervention method. So those will include a lot of other services, like extracurricular services that are not necessarily intervention. And somebody who is outside of the BC, unless they are partnered with the BC related governmentary body, then you won't be able to use the expense for their services. And yeah, and I think this is the special authorization, that you will be able to use some of them if you're already authorized before you use the money for these type of services or situation. So here, it doesn't say over here, but I think when I read this limit, it does sound like 20% of the benefit we'll be able to use them for the non-intervention related cost. So this is where they're saying they're giving the choices to the parents. So once you have the benefits available for you, you will have three ways to choose how to get the money from them. So first, that will be direct payment. So you get the money from the government, and you take care of everything, but you will have to work with the government to show that, to prove that you're using that money for the intervention for your child. So that is what is going to give you the high stress for the admin process, but you will have more freedom and you will have more choices. What are the services that I'm going to go for? So you don't have to make the contract with all the different agencies, and maybe you don't like them in a 2 weeks or so. You will have to talk about the breaking the contract or whatever. But when you are doing it by yourself, you will have more control over it. However, that means they are going to be auditing. And when I read about the auditing, they are saying they are going to check all the receipts and the supported plans for each service providers. So you will have to make sure you always have those kind of reports from the service providers for every little services. I'm not too sure how they're going to do it, but they said they are going to check all the support plans by those service providers and receipts and invoices and everything. And for the second one, this is more like an autism funding portal. So that's how our center is doing too for most of the clients. And government will give each service provider the right to invoice through the portal. And the clients look for those agencies or service providers that will be able to fund invoice to the CYSN. So that's where you're looking for the provider and they are going to be invoicing under your name to do so. So this is a similar with the autism funding, but the third one is also quite different. So you're going to be working with the agency itself, and they will take all the monies for you, and they will provide all the interventions to them, so to you. Sorry. So, for example, like a CDC, they're already pre-approved community-based service agency, and they will be receiving additional fundings that you're saying okay to, and they will be coordinating all the services that you're looking for from them. So then any agency, no service provider will need to do any sort of admin stuff, but those agencies, the local agencies, will be dealing with everything. Supplement is income-based supplement, like financial aid. So this has 6,000 per year at max. So that's more like an autism funding after the kids turn 6, but the difference is this is income-based. So if you have the DTC already for your child, then you will be automatically considered for this and you will be qualified. However, based on your net income as a household, the income drops fairly quickly over 100K. So from 50 until like up to 50K, you will be able to get 6,000 per year as the supplement, and the money will go drop down up to 4,000. But I think in the later, some paper says 4,500 per year for up to 100K. So I think they're saying, I think I saw 4,500 in the FAQ announcement when they are doing the info session later on. So I think somewhere between 4,000 to 4,500 will be the supplement that you can get if your household income is 100K. Then the supplement drops pretty quickly down to 800 per year. So that's how much is it? Like less than $100 per month if you're making, sorry, if you're making 180 per year. So that makes around 200K then you will not have any supplement, even though you have the DTC. So that's what it is. And they were giving the reason why they chose 200K for the threshold that you won't get anything is because if your household income is over 200K, then you are making more income than 90% of BC families. So that's why they are saying you're considered to be a high income family. And the supplement you will be able to use for everything. And if you have multiple kids, multiple children that has the DTC, then the amount will be a little bit different. So here, if you're making up to 50,000, then the numbers aren't changing. One kid, you will still have 6,000, two kids, 12,000, three kids, 18,000. So it's the same. But for if you're making 100K, and if you have one child that is eligible, then you will get 4,000 per year. And if you do have two children who have DTC already, then you will receive 10,000 per year. So that will be a little bit more because you would only gotten 4,000 if you had one kid, but now you're getting 5K for each kid. And if you have three kids with the DTC, then you will receive 16,000. So this is a little bit more than if you had only two children. And if you have 180K, so in previous graph, we show that you won't get more than 100 per month. So like this, you will only get 800 per child per year. But if you have two children, then you will receive 60,800 per year. So the amount goes actually a bit up. And if you do have three kids, then the number goes a little bit higher than before. So I think they are trying to understand the family with the multiple children with the DTC so that they can support a little bit better. And I think this will be helpful for some of those parents who may have twins or sisters or brothers or other siblings that have the same conditions. So I think this will be useful. If we're looking at the summary, so paperwork, this is only going to be for the direct payment. If the parents decides to get paid by themselves, like directly from the government, then you will need the approved support plan on your hand to get audited. But approved support plans for the service providers or local agencies are going to have them anyways, and they are authorized to provide those services, so you won't need them on your hand. And the administration for this benefit will be by the ministry, and eligibility will be determined by the needs. And functional needs, meaning adaptive skills, adaptive behaviors, how they are like to be independent in the daily lives. And because they are trying to support the interventions for specific disability services, they are going to be limiting where you can use. So you gotta only use it for the intervention. That's what they are saying. And for the supplements, it's a household income help for having the kids with the disability. So they won't worry about where you're using the supplements. And you need the DTC and only the income threshold to be determined how much you're gonna get. And next year, the supplements amount will be determined by this year's tax return. So you'll have to report your tax for next year. For this year's income, you will have to, so that they can know how much they can give you if you're eligible. And this is going to be dealt with the CRA. And this is automatic, so you don't need to apply. I think a lot of people are asking them, and they made it clear that you just need to make sure your child has a DTC. If you do have the DTC, you don't have to do anything. So you need to just make sure you got DTC and you filed your tax. That's it. And there won't be any audits. So they're going to be saying, oh, this is the money for you. I'm helping you. You use it whatever you want to. Third one is expanded community-based services. So this one is more like the current services, but they are going to try to expand the services and the number of the service providers who can help in that local agencies. So those of you who may had some consultants coming into your children's daycare to observe and give some recommendations, and some children may have gotten some free preschool support from those local agencies after waiting for a bit. Those are the community-based services. And they are saying they're going to be expanding who they can support and what are the services they are going to be providing for them. So right now, this year, they're going to be working on a lot on expanding the early intervention wise. So that will be more of the therapies related with the younger kids. And around next year, they are going to be working on how to help with the behavior and mental health. So that will probably include behavior related supports, and the mental health will be more like a counseling for the younger kids. And they are trying to look for some ways to help with the family counselings or other family navigation services. Then around 2028, that's where they are going to be designing some programs for school-aged kids. So I think this is where a lot of parents are worried about, because there will be some gaps between the services. I mean, the gap after the autism fundings are done until any of the youth program will be available to the community. I think this gap will be very important, and we need to really plan out carefully. However, they are trying to give out a good amount of new investments for expanding this community-based services, and they are giving out the timelines very clearly. So I'm hoping that they are going to have enough support and service providers to cover all the kids between 6 to 18 that won't be eligible as much as right now, at least for the autism funding. Because we will have some kids who won't be able to get the same amount as the autism funding, even though some will get more funding. So what stays the same? That shows what is going to be the same when you are looking into these benefits and supplements. So you will need to have some diagnosis if your child has some difficulties that require some support. If you don't have the diagnosis, then they won't have any understanding of how to support and how to determine. So you will always have to actively looking for what kind of diagnosis my child has. That will include physical disability too, physical challenges that will need somebody to support the learner throughout the daily lives. So I think even any kind of physical challenges that you noticed in your child, I think it is better idea to consult with your doctor to see if this can be any kind of physical challenge that can prove any of the support. School support remains the same. This is something that a lot of parents were worried because they thought, okay, so if they're pouring more monies for other kids that doesn't have the autism but other complex conditions, then will the school lose the funding for my child so that school cannot do anything for my child too? But that's not true. The school will still get the same amount of the funding per child. So if your child may lose the benefit and you're only getting the supplements for your income, but your child will be like equally supported in the school, because school will still get the same amount of funding per child. And medical support, I think this is more for the family with the at-home program already, because at-home program has the medical equipment and supplies and the therapy fundings. And now the therapy funding will be transferred to the benefit, and the medical equipment and supplies will remain. Staff continuity. So they are going to be, so still CYSN workers will still support the families if they have any questions or anything, any concerns about it. They will be able to help them out, help you guys out. And these workers are the ones they will be calling you in the future and try to arrange anything. If there is any retest needed or if there is anything they need to identify from you, they will be calling you. For the respite care, so this is something that I briefly mentioned. If you do have the respite care, then you will still get the respite care. It's not they're trying to take away any respite care from you. They are going to be keeping the same respite care availability. So if you do need to look for any respite care, like just now, then they will still get the applications and they will process the funding to provide some respite cares for the family who's in need. So please do not feel like you're gonna be helpless because everything is gonna be changed, but try to look for any benefits or supports that you can get because schools are gonna be supported the same, and they're gonna still keep the respite cares and diagnosis. They're going to be looking at it. So I think it will be important that we keep looking for what we can and try to advocate ourselves. Transition time. So right now, if you haven't had the DTC approved, this is a good time that you can look into it because I'm pretty sure after this information was released, a lot of families who didn't have the DTC yet, probably they've started apply to it. So do so. And if you do have the DTC, then I think it's time for us to wait. I think there is nothing we can do. Maybe something we can do is maybe if you aren't too sure if your child has the intellectual disabilities or not to be combined with the autism, and if you think the diagnostic report isn't enough to support that, then I think maybe looking for ways to get that diagnosed. Like it will be tested and diagnosed, but I think it will be important if you try to find some ways to be checked on. Okay, so from now until next March, they are going to be making the transition, and they are going to decide how we are going to be determine the kids without the traditional diagnosis that will go into the pathway 1 to determine the eligibility. And they are going to be making some transitions for the current families who are already receiving those at-home and autism funding. So that will be until next March, and they are calling it phase 1. So during the phase 1, they will be discussing who's going to determine what tools and what will be criteria to determine if the family will be getting the benefits or not. And from April 2027, the new model will be replacing fully for the current funding system. So that means autism funding will be done by March 2027. But they are saying RAPS, the Registry of Autism Service Provider, that will be still available in the government site, just so that families with the benefit, and if the child has the autism, they can look for the service providers there to be approved. But yeah, we'll see. Sorry, my voice. I've been working since Monday after landing from Korea, and I didn't have time to relax my vocal cord. Okay. Transition timeline. So if you're already receiving any support, like at-home or autism funding, you will be contacted by the workers from next month. I think so from this is the transition period, and I think, do I have another one? Oh, maybe not. So in the phase one, they're saying from next month, workers will be calling you so that they can discuss how to transit from the at-home funding for the therapies to the benefit. And I'm not too sure. Like, I think I got the question yesterday, and I've been actually wondering about it too. But we have no idea what they are going to be talking about when they call you. So if you're the one who has the at-home funding, and if you get the phone call in the beginning of April, then please do not hesitate to let me know what they discussed about so that we know what are the things that they are already like ready to say to the clients. So that will be in April. And for the kids with autism, but without the at-home program, I think we'll have to be waiting for the phone call from July this year. So from July, please pick up the phone call, even if you don't usually pick up the phone call from unknown numbers, because I think that can be very important for a phone call. And for the invoices for the autism funding system, that will be only accepted until March 31st, 2027. So I think safe to say that we can process the invoices to the autism funding by the end of March. And I think my center will try to do it before 31st. So maybe 29th or 30th to close the invoices. So that's what they're going to be doing for the transition. And I think in other ways, they are going to be working to identify and give out the benefits to the people who didn't have any sort of fundings before. So I think that will be something that they will be working at the same time here. Yeah, and April 2027 and going forward, every new funding system that we just talked about will be fully implemented. And the thing is, supplement payments will be starting from July 2027. So I got another question, and I actually didn't think about it when I read it. But one of the caregiver yesterday, she asked me, then what about from April until July? Supplements are supposed to be a few $100s per month, but what about this 3 months? Ooh, I'm not too sure, because I know autism fundings are going to be gone. But then you won't also get the supplements that I don't really know. I'm so sorry. I wish I know the answer. But what my guess is that they are going to be giving the extra time to process before they get all the tax informations for the families to determine. So I think that's why they're making a little bit slower to give out the supplements. So we'll see if there could be any updates, and I'll try to let everyone know. I will share them. Okay, so this is about it, and I'm going to be explaining some examples just for your understanding how these are going to show some changes. So if you feel like you do have all the information about the funding systems, then it is okay for you to go, but this is going to be more of the examples, like scenario examples. And these are not real cases, but they are just giving out the examples. Let's see. So for a girl, Chloe, she has a Down syndrome and she has intellectual disability and she has a spinal deformity. And I was actually shocked for this because so when she had these three conditions and the income was $110K, she would qualify for 6,500, sorry, $6,500 for the benefit. So even if she has the Down syndrome and intellectual disability, that doesn't automatically give her the maximum amount. So I think this is where we really need to be carefully thinking about how how you can get the maximum benefit, and that will be a lot of needs that your child will be needed to get the maximum amount. Because I think given this condition, they're assuming that 6,500, meaning the criteria will be very high to get the maximum. But truth is, right now in the current system, this type of conditions, they don't get the supplements or anything after they are 6. I think before that, they at least have some community-based services. I think that's why they said early therapies. And so before, she was able to get some, but afterwards, she was not having any sort of fundings. But after the new funding system, they will get the benefit of 6,500, and because of the income, they will get 3,600 for the supplements. So they will get around 10K per year from even after she turned 6 until she become an adult. So that's what they say. Usually, this type of condition, you feel they need some support to work on some stuff, but they don't have any kind of financial support. So they weren't able to do anything. But now they should be able to get something to work on some interventions or therapies. So I think that's what they are trying to show here. And Sam, autism level 2, it's a fetus alcohol syndrome and the ADHD and intellectual disability. And it's a single mom, and income is 50,000, 50K. So in this case, right now for these kids, you used to get 20K until he's turning 6. And after he turns 6, his funding drops to 6,000. So this is where 6,000 came from. So this is current autism funding system. And now they're saying by replacing this to the benefit and supplement system, he will qualify for 6,500 per year. And because of the income, he will get another 6,000 as the supplement. And this is another one. So autism level 2, I'm trying to upload another video about the autism levels and intellectual disability levels and so on. But here, autism level 2 is actually requiring substantial support. And it is combined with the intellectual disability. But still, it is assuming that he will get the 6,500, not maximum or a little bit more than 6,500. So this is what I'm thinking. A lot of families who will be eligible for the benefit will still get 6,500. It's going to be difficult to get maximum amount. We'll see about another example with the 17K, but yeah, so that's what I'm thinking. However, when you look at the lifelong support Sam gets here so right now he's getting 12K, around 12K for whole entire childhood and the teenager. So until he becomes 19, he will be able to get all 12K for every year, and that will increase the lifetime support that he gets until he becomes the adult. So that's what they are saying, that if your household income is not too high and if your child is significantly needing the support, then your lifelong support will be at least more than right now. Here, Huxley. Huxley is medically fragile. So medically fragile meaning a lot of physical challenges that really needs somebody to be always full-time with him. And severe ID. Severe ID is usually meaning below 40 or 30, depending on the adaptive skills. And net income for the family is 150K. Current system, because he doesn't have the autism or anything, but he may get the at-home program. So they're saying at-home funding was about this per year. And I think I think they could have made it multiply by 2 or 3 here because I know at-home funding gives 2 to 3 different therapists per year to get the amount. But anyways, for now, let's see. And after the new funding changes, they're going to be giving Huxley 17,000. So that will be significantly more. And because the family makes the higher income, but still less than 200K, they will be getting 2,000 per year as the supplement. So then he will get 19K in total per year. And on the top of it, because he's medically fragile and he's with the at-home funding, his medical supplies with the equipment won't be gone. He will be still getting it. So those supplies and equipments remains, and the amount that he gets will be more. Because of that, the lifelong funding grows from this and that. So he is getting a little bit more. Even if we calculate more for the number of therapies for the at-home funding, I think the total still grows because he is getting more. And this would have been lifelong. So I think that should be a little bit different. Yeah. And for Ollie, he has the autism and he's highly verbal, has the ADHD, and no intellectual disability. And I remember from the example that he has the social interaction problems, and that includes a lot of emotional regulation issues with the friends, may have some supports needed throughout intensive support in the school setting. And the family income is 120K. In the current system, because he does have the autism, he gets 22K until he becomes 6. I don't know why it made it there. Sorry. So he will get 20K until he becomes 6. And when he turns 6, he only gets 6,000 per year. So that is total around this if we got it a young age enough. However, when the funding changes, this is the only type of example that drops the funding. So because he is highly verbal and no intellectual disabilities and no requiring substantial support to prove some ways, he will only get supplements for the family's income. So that will be 3,200 per year, and he's not qualified for any sort of benefit here. And however, he will be able to get the community-based services as the priority. And that will be happening in 2028. And we don't know how that's going to be happening. Of course, I think in these examples, because they are saying, oh, only getting the autism or autism level 1 doesn't mean that it's going to be excluded, because there will be pathway 2 to see how to prove the learners without the diagnosis that's included in path 1 still need some substantial supports needed. So I think it is still important for us to wait until how they're going to be determining it. So if Ollie here, still the same profile, but then maybe if the pathway 2 says, oh, if these are the professionals can do the assessment that's determined in this list, and they can do the same functional assessment for this child, and if they say this child's suffering a lot, so he needs the substantial support, then he can be eligible for the benefit. So these examples are just giving the examples based on the diagnosis. So for the pathway 1, because pathway 2 is the one that we are not sure, like no one knows yet, it's unknown. And then this is the Elliot. He has autism and he has a severe intellectual disability. He's nonverbal and he's 5 years old. The family house income is 95K. Currently, he's receiving autism funding, 22K, and dropping to 6,000 after he turns 6. And around this will be after he receives the at-home funding for the therapy, after he turns 6. As far as I know, after he starts the school, that's when he can get the fundings. So this will be around the total for his childhood. And after the funding changes, because he has a severe ID and a nonverbal, he will be able to get 17,000 as the maximum benefit. And because of the family income, he will get 4,200. So if we combine them, this is going to be a little bit over 21K and until he turns adult. So that will be significantly more because after the autism funding drops to 6K for him, he only had 16K around, including at home, but now he gets 21K. So for him, when he's younger, his lifelong supports increases significantly. That's what they wanted to show here. So this is summary of the examples, and nothing changes, but it shows how Ollie, the autism with the highly verbal skill and no intellectual disabilities or any difficulties, he's going to have some drops of the funding. And lifetime change drops just a bit, only because they are also calculating the community-based services. So they're assuming that Ollie will be able to receive some sort of community services. I think they will try to make it right so that Ollie will be able to get some sort of community-based services. But I think as if I think from the parents' perspective, I think something that be will be hoping is that we can choose who I'm going to be working in the community-based services, but I'm not too sure how that is going to be happening. So here again, this is a summary of benefit and supplement and how many families are they expecting to qualify for the funding. And they say 80% of the family who are receiving the services already are going to be qualified for the benefit and or supplement. So I think and or shows that if you're not qualified for the benefit, but if you're qualified for the supplement, then they are including you in here. So if you're making more than 200K, and your child is not qualified for the benefit, then that's what's gonna make you another 20% here that's excluded from here. And they say 46% of those who qualified for the benefit will be able to get the maximum benefit. So then we can go back to the example and see those two are with the highest support needs. Even with the diagnosis itself, we can see that those kids are the ones with the highest support needs. And those kids are definitely going to get the maximum benefit, but others, I'm not too sure how we're going to be determining it, but they will probably announce how they're going to decide on it. So we'll see. This one, I'm really, really looking forward to it. And 74% that has under $100,000 as the family income. So they're going to be getting at least more than 4,500 per year or more. So this is where I mentioned from the original announced material, it says in the graph, it says 4,000 per year for up to 100K. But here in the FAQ announcement, which is a little bit more recent, is saying you will get 4,500 or more as you go from $100K on and under. So I think probably this is going to be equal 4,500, but we'll see because original guideline says 4,000, and that will be 74% of most of people who qualifies for it. Okay, and a lot of sentences were saying about the 80 million investment over 3 years for the community-based services. And it is a lot of money. It is a good amount of investment. And I think if they're working on it, it will be successful program. But I don't know how they are going to be gathering the service providers and how the qualifications or service structures are going to be arranged there. So I think that is also something that we're gonna have to wait and see as well as how they're gonna determine the functional needs they have. So to wrap up, I think as a parent of a child with the special needs, something that you want to make sure is you get the DTC. And I think another question I got from yesterday is that uh, no matter how we strongly advocate to get the DTC, uh, the content of the DTC won't be something that's advocating for the benefit. DTC is only related with the supplements. So if you don't have the DTC, just get the DTC. But what you talk to the doctors about to get the DTC won't change anything about the benefit. CYSN already said they're trying their best not to retest anyone to determine their needs to see if someone is qualified for the benefit or not. So they're saying the reports that you had when you get the autism funding should be enough to determine if you're sitting for the benefit or not. And I think that is why we need to wait for the determination criteria. And secondly, make sure you file your tax before the deadline next year so that the government knows that how much supplements you will have to get paid in July. And then wait to be contacted. So wait until they call and you don't have to cancel anything. I don't know if anyone is thinking about canceling. I know some parents may think about canceling DTC because they are not qualified for the supplements or some other reasons. But yes, if you really don't care about the supplements and any other supports that you can get as the DTC, then yeah, feel free to. But if you don't think about it, then keep it and just wait and please pick up phone calls from unknown numbers. As the kids with the autism, we need to wait until July. So before that, I try to send them so many emails and they only send out the automated message, like automated, like, oh, we are still working on to get the accurate informations and we're still in the discussions. So I think now it's the time to see, like look through the diagnostic evaluation report. And if you think it will be better to check out the intellectual disability part only because you highly believe your child may have some difficulties in there, but the original autism report didn't say anything about it, then maybe it is worthwhile to look into the possibility to get an appointment with the assessment. However, if not, I think it's time to sit down and relax back. I think there's nothing we can do at this moment. We just have to wait how the government decides on the criteria that's not clearly released yet. So I think that's what we can do. And this was all the materials that I summarized up to now. And I really, really appreciate someone who, like everyone that's been listening very carefully and with the attention. It's even though that was a lot of new informations, but I know that this is going to be very important changes for everyone. And as a behavior consultant, I value how much this is going to be supporting the needs that was really sad to see. So for kids in the example who's gonna get 17,000 as per the benefit, those are the kids that's been made our team very sad to see because they really, really needs more support, but then they couldn't do more intervention. So we feel grateful for them. But at the same time, when you see another example of Oli, who is going to be losing a lot of fundings, then we feel sad because we value how those kids can thrive with the less support than the kids with the highest support. And they can be somebody who, like, they can be someone who's going to grow up as a very dedicated, dedicated adult who can support the society. So I think I feel mixed feelings. I do have strongly mixed feelings about this change. So I'm happy for some clients, but I'm really, really desperate for other clients. And I don't know how they're going to be working on, but we're like our center will keep looking to see if they're going to be announcing anything about the partnershiping with the private service agencies or anything for the high functioning autistic kids who didn't qualify for the benefit in the future. But they said they're going to be welcoming those interests, but then at this moment, they're going to be only working on expanding the current local agencies. So we don't know how this is going to go, but I know in 3 years, what they're trying to make is going to be a big change. And that big change will be not easy, but I think they will still keep trying. So if anything new opens up, then I'll try. And if the information is again a lot like this, then I'll try to update and share the important changes in here again. So keep watching, keep paying attention to the emails that we send out to our clients. And if you do have anyone who you know, maybe your colleagues or your friend or your relatives who are suspicious or like really anxious about this funding changes and didn't really know like what's gonna be the change, then please feel free to share this video because I'm gonna be just leaving this video in this channel. So thank you for listening, and I'm gonna be wrapping up in here. Okay, thank you. Have a nice Saturday.